Hi there, my name is Dr. Eric Chang, and I'm a board-certified OBGYN with subspecialty training in female pelvic medicine and reconstructive surgery, also known as urogynecology. As a native of Northern Virginia, I'm very excited to be back in the area as part of the Advantia team and look forward to providing quality, compassionate urogynecologic care to the women of the region. So urogynecology, or female pelvic medicine and reconstructive surgery, is a subspecialty of OBGYN and urology that deals with pelvic floor disorders. So pelvic floor disorders are not a disease per se, but it's a constellation of conditions that can arise when the muscles of the pelvic floor are stretched, torn, overworked, or weakened. These particular conditions can include things like leakage of urine when you cough, sneeze, or laugh. That's called stress urinary incontinence. The constant feeling of urgency or frequency of urination, that gotta go feeling, that's called overactive bladder, or the feeling of a bulge coming out of the vagina, or the physical presence of a bulge in the vagina, that's called pelvic organ prolapse, and it's kind of like a hernia through the vagina. So the good news about all of these conditions is that they're rarely life-threatening. They're what we call quality of life issues. Now, with that being said, they can be very, very annoying to live with. And the good news about all of that is that there are lots of treatment options that are available to patients with pelvic floor disorders. So pelvic floor disorders are more common than you may think. Prior studies have shown that up to 60% of women may develop a pelvic floor disorder at some point in their life. Pelvic floor disorders can be quite embarrassing to talk about sometimes, and as such, they may rarely be brought up to your physician. What's important to know is that there's treatment options for all of these conditions, and by bringing it up to your physician, your OBGYN, your family med doctor, you may be able to get to treatment sooner. So there's various ways that we treat pelvic floor conditions, and it's based on what particular condition somebody may have. These conditions can be treated by a variety of ways, and they range from conservative options all the way to sometimes more invasive, including surgical options. The more invasive options, surgery for example, are oftentimes the most permanent and the most effective. All of the surgical options that are offered are done in a minimally invasive fashion and offer quicker recovery times. However, it's up to you and your physician to kind of talk together and come up with a good plan of what treatment option may best suit your needs. If you've been experiencing any of the urologic or gynecologic issues that I mentioned, I'm here to help.